when I was eating lots of fruits and was like high sugar, the anxiety was over the roof. They will read and understand, okay, so this makes sense. It's like science. It's not just you have to believe it just because I say it. What I experience and what I see with the patients is really, this is how healthcare should be. I was so happy to be able to do for the patients what's right.
Welcome. Today we have with us Danjela, who apparently is in New Jersey. I guess you've got a fairly interesting story to share for us. So maybe to start out, tell us a little bit about maybe your background, who you are, and that stuff, and then we can get into what has progressed and happened over time with your health.
Yes. So currently I'm a nurse practitioner. I've been a nurse practitioner for 2 years. I worked as a nurse at bedside for 8+ years, med-surg primarily. And, just like everybody else in healthcare, I was, focused on keeping myself and my family healthy by eating a lot of vegetables and staying away from meat and, everything that the mainstream talks about. And then it was after I delivered my second boy. I have 2 boys. The younger one is 4 years. After I delivered him, during the pregnancy, I developed fungal infection on my toes, and I couldn't have antifungals because I was pregnant and then I was breastfeeding for a year and a half. So when I delivered him, I wanted to lose weight. I gained much more weight with him than with my first one. And I came across, I started searching helpful diet tips because what I was eating was not helping me lose the weight. I was eating a lot of vegetables, lots of fruits. I was having meat maybe once a week, and it had to be lean, like no fat whatsoever on it. And I came across keto and your videos and Dr. Camberry, and I was like, maybe, let me try, who knows? And then I started reading more how it can help not just lose weight, but heal chronic disease and improve health. And I was like, okay, maybe this will help with my fungal, toe infection and everything else. I would get, moody during my periods. I'm also very anxious person. I want things done. I cannot wait. When they need to be done, they need to be done. And when I was eating lots of fruits and was high sugar, the anxiety was over the roof. And I wasn't expecting this will improve just because of the diet, just because of I was skeptical. I'm like, okay, I'm going to give it a try. Who knows? But is the opposite of what I have studied. So, and I started eating the diet. It was not easy in the beginning. Just mostly was the mental thing. I had to eat so much fat and my body wanted fat. I couldn't believe it, how much fat I could eat. Sometimes I would just stop and be like, I'm still hungry and I'm not throwing up and this tastes good, but is it good for me? I always question myself. But when I saw the fungal infection clear out completely, for 2 years I had it on my finger and I went to dermatologist and she said, I'll give you antifungals after you stop breastfeeding. And when I went to see her, she's like, what did you do? I'm like, nothing, I just ate good food. It was shocking. And then I also saw improvement in the mental health, being more calm. My husband, he's like, I don't even know when you have periods right now because you are always in good mood. It's very hard to get me upset. It takes a lot to get me upset. And then I started talking to my husband, you have to try it, because he was on antidepressants. He was overweight and he had 40+ pounds to lose. I'm like, you should try it, because I was skeptical and it did much more than I expected. And I lowered also my Levothyroxine, the thyroid medication. So he tried it too, and he lost the weight. He came off the antidepressants. And then I put all my family on, not so much carnivore because they still love some vegetables, but keto. very low carbohydrate, natural keto diet. My mother-in-law came off her cholesterol medication, her blood pressure medications, and her rheumatoid arthritis is so much better. No medication. She has pain now every now and then, but she doesn't need no medications.
Yeah. I mean, it's interesting because, you've got a whole variety of things that, in modern healthcare, we would probably think none of these are really diet related. I mean, other than weight. I mean, everybody would concede that diet has an impact on weight, but a fungal infection, you'd never think that, obviously you said you had to avoid antifungals because of pregnancy. And had you not been pregnant, you might have taken the antifungals and, and obviously, there's problems with antifungals sometimes, depending on what they are. Sometimes it has liver toxicity and some of those issues. And then of course, anxiety, which is another one where we put people on some mood stabilization drug rather than think, well, hey, let's just fix your diet, and maybe you're aware there's a relatively new paper within about a year ago came out showing an animal-based ketogenic diet significantly improved anxiety after about, I think it's something like a 7-week period on this pretty extensive case series. And then, rheumatoid arthritis, another one, it's just like, well, maybe it's, it's take, steroids, take, corticosteroids, take, disease modifying drugs, immune suppressive drugs, things of that nature. And again, diet can impact all these things. So, and, you have a medical background, you're a practicing clinician, and now I know you're working with us at Revero and probably
Yes.
practicing in a very different way than you might have practiced throughout your career. Is that a fair statement?
Yes. Oh my gosh. Yes. I've been trying. Like when I first heard about Revero from listening to your videos, I was like, oh my gosh, like it's like God listened to me. I wanted to like something that will focus on improving health. I'm like, this is what I want to do. And I applied right away. When they called me for the interview, I was crying. I was so happy, to be able to do for the patients what's right. Like, because now that I know what I know and the regular job I do is very like conflicting. Like I'm there, I'm looking at them, and sometimes, I tell them, some of them believe me, but then I cannot practice it the way I want it. I'm just managing their disease, you know.
Yeah, I mean, disease management is the modus operandi. It's like what we've been trained to do as a healthcare entity. As physicians, clinicians for the last 30 or 40 years. I mean, it's just like, hey, we're just going to manage your disease, and there's no really discussion about, hey, we can cure this. We don't, we can make this disease go away. It's management over and over again, and yeah, it is, particularly when you know better. At this point, you're like,
Yes.
look, and then you're practicing, because I assume you're practicing in both, maybe some for Revero, maybe some in your original
Yes.
practice. Yeah, and
Yes.
so it's got to be like, you know, I
It's
don't know if you
very.
ever convinced some of your patients from the regular
I
standard practice to
actually did.
come over to Revero.
No, well, yeah, she might sign up. Uh, she was talking to me about irritable bowel syndrome,
Mm.
and she told me, I've tried these meds, I've seen so many gastroenterologists, they've done all the testings, but nothing has helped me. I just have a label, like I know what I have, but there is no help. I'm just having the symptoms. And I'm like, okay, so tell me how you eat. And she's like, I'm vegetarian. How any much better can I be? I'm like, yeah, I think you are on the wrong diet. So I explained to her about the fiber and all that, and she's like, "Oh, what you saying makes sense." I'm like, "Just try change your diet a little bit, slowly, not overnight." And then I follow these people; they stay longer at the place. And she called me the other day, and she's like, "I started eating meat. Guess what? My diarrhea has improved."
Mm. Yeah.
So I talked to her about like what I do also with Rivero, and she's very excited. But the fact that she listened to me, means a lot.
What you said I think you said you're living in New Jersey. Are you licensed in a few different states right now? What is
Oh,
your situation?
right now, I'm just in New Jersey.
Just in New Jersey. Okay. Yeah, because I know we have folks now that are licensed in all 50 states. We've had them for a little while now, so it's interesting to see. So just with regard to the Revero patients you're seeing, what kind of patients are you seeing, and what kind of results have you been able to achieve so far? Hey folks, it's Dr. ShawnBaker here. Hey, if you or someone you love is suffering from chronic disease and you're tired of just managing symptoms with potions, pills, and procedures, I want you to check out Revero.com. Our team of dedicated professionals is committed to tackling the root cause of your issue and finally getting you healthy. Hurry up, though. Our spaces are filling up very quickly.
Yes, so most of the patients like diabetes. So one of the patients, she came with being pre-diabetic. She was very anxious because her mom died of Alzheimer's, and she's like, I don't want to get there. She has read and been informed that like Alzheimer's is type 3 diabetes. So she's like, I need help. I want to prevent becoming diabetic. So now she's not diabetic anymore. And she was so happy. Like she couldn't believe it. She was pre-diabetic for like 10 years. And she said that, like just for 3 months, she just did, the diet for 3 months, and she was able to reverse that. She also improved her cholesterol. Yeah, so some of the patients that I have had are like with high cholesterol, like meaning triglycerides, not like, like the LDL and HDL, they are normal because they are on statin, but their triglycerides are over the roof. And I've seen improvement in that. Also, like gastroenterologists, like irritable bowel syndrome, Crohn's disease. Another patient, I had a very interesting patient that had symptoms of long COVID, like no exercise tolerance, also unable to sleep, tachycardia. And he has tried so many like homeopathic, remedies, different doctors, and he has felt the best after joining Revero. He's been able to work out now, join the gym again, and build on like immunity, because he used to get a lot of infection, upper respiratory infection. Even after he was diagnosed with COVID, he could not feel himself.
Yeah, wow, that's and I assume you've been able to take some patients off medications. Is that fair to say?
Yes, yeah. This guy, he was on a lot of like, he was also he did some testing, and they told him because of the COVID infection, he had some problems with clotting. So he was on a blood thinner. So they had him on Jardian. So, he has been able to come off those medications. Like the cholesterol medications, almost always, like they come off that. Metformin.
Interesting. Yeah, and obviously that you avoid the side effects, the cost, the need for, chasing prescriptions all the time, which is, sometimes problematic for people. As far as, the difference between, well, one of the things when you're practicing within like a, a hospital system or even in a clinic outpatient, you don't have a lot of resource for lifestyle. I noticed that as an orthopedic surgeon. I mean, all I could do is like, hey, go watch this video, go read this book, here's a handout I could hand people. This is back when I was still actively practicing orthopedics, and I was just too busy. I just had, and I had no resources. Now with Revero, you have a team at your disposal. And how does that feel, having that level of extra support for the patients? Does it facilitate things?
Yeah, it feels amazing for me as a provider to have a support like that. And also like the patients, they have access to the chat like 24/7. Like whenever we can, we get back to them. You don't have to wait. Like if they want to set up a call or visit with us, that's available too. But if they're experiencing something, they tell us right away. You don't have to wait like weeks in advance. Or when you call the doctor, there is, the secretary picks up the phone, and then the nurse. By the time you get to the doctor, you might be dead, or you have to go to the emergency room. Is like amazing.
Yeah, it certainly is. I mean, it provides a higher level of contact, because patients have access to their team basically, as you said, pretty essentially 24/7, either through chat form or calls or Zoom calls or whatever it might be. And that, you're able to make rapid changes. Whereas, the typical thing, as in your typical practice, you might see patients once every 3 months, maybe 6 weeks if they're a little more acute, or 2 weeks or something like that. But you're not seeing them every day. I mean, it's just impractical or essentially impossible. Couldn't afford to do that. So that's got to be neat. And then you have access to a lot of data that you wouldn't normally have. Is that also fair to say?
Yes, yes. The patient can read for themselves. Like, you don't just blind, they don't have to believe us blindly just because we say it. There is resources for them to read. Like, if they have questions about like cholesterol, there is studies. They will read and understand, okay, so this makes sense. It's like science. It's not just you have to believe it just because I say it. Yeah, they
Yeah.
have like the coaches and the diet planning is a lot of support. Like, imagine like the normal primary doctors, like if you have some kind of symptom because of the medication you took, unless it's life threatening emergency, okay, you have to go to the ER. But if not, it will take long time for you to get the answer, oh, it was the side effect of the medication. But as we view all the data, that like their vitals and everything, if we see something abnormal, like I had a patient on Jardian whose sugar was like low, so we call them right away. We don't even wait for them to tell us. Like, we see it and we reach out to them.
Yeah, it's like I said, I think it's redefining healthcare in many ways. And I don't know if you know, but we're about to go through another funding round to expand our scope, so we can hopefully, because I'm sure you want more patients, I would imagine, from the
Yes,
Revero
yeah, I
side.
want Revero to be my full-time job.
Yeah. So we gotta continue to expand our scope so we can get more patients to keep you guys hopefully full. Because it would, yeah, I mean, it's got to be more fun. In your normal job, your standard job that you have, do you ever discuss what you're seeing at Revero with like some of your peers, any other physicians, clinicians that, is that ever, because you're like, hey, I see this here. Does that ever come up?
Yeah, so most of the time, they come to me, they ask me because they see what I eat, and they ask me like, how old you are, this, that, and I tell them, and they're like, well, what do you do? And then I'm like, okay, now we start. And then I start telling them. And one of my coworkers, she started changing her diets. She saw some improvements, and whenever we would see a patient with like heart failure, and we would look at each other, and she's like, yeah, I know what you're thinking, like. But you can't just go talk to everybody sometimes. Like, I wait for them to give me a sign, like I'm willing to learn.
Yeah, I mean, I could say every time I go to the grocery store, I'm like, you're looking at somebody and they're obviously clearly not in good health, and you look at their cart and you're like, oh man, you could totally change. But it's not your place necessarily to jump in there unless they have an interest to make a change. And the one nice thing about the Revero patients is they all pretty much want to change. I mean, we basically screen them for that. I mean, then you don't get in our program unless you're willing to make some lifestyle changes, and we're happy to support you in that. I have the pleasure now twice a week. I meet with all the patients, or as many patients who want to show up, basically. So there's usually 50, 67 at a time, something like that. It's a lot of fun hearing their stories, and it's a very happy, positive vibe when you see people going from pretty sick to dramatically improving their health, which is kind of unusual in medicine, quite honestly, because you kind of just get the same people that you just kind of, like you said, you're managing their disease. You're just kind of keeping them alive, I guess, maybe, but I don't know that you're making them any healthier.
Yeah,
Yeah, so
yeah.
that's interesting. So as far as what have been your favorite? Do you have a favorite type of thing you like to treat, either within your regular job or with Rivera? What's your favorite thing you like to do?
Yeah, I love endocrinology. I don't know why, but I love to treat like people with diabetes. I mean, I don't have much experience in the thyroid, but yeah, endocrine. is just the most interesting for me. And I've had like a lot of people like in my family, like extended family, that have suffered with diabetes, and I've seen what they like. They've been to dialysis and lost extremities and this and that. And then now that like I know the answer, like I just wanna people not to get there. Like if there is help, then why not?
You mentioned endocrinology in the context of thyroid, and just because you said you were able to lower your thyroid
Yes. Yeah.
medication
Yeah.
by changing diet, which is kind of interesting. Had you ever thought that before, or was that anything, in your years of
No.
clinical care you thought about?
No, never. I was just like, this is, I might get more, like my medicine might be increased, but never decreased. And, you know, that was like very shocking.
Yeah, and I mean, there are some published data out there. There was a study out of China last year looking at low carb diets and hypothyroidism, Hashimoto's specifically, and they saw reduction in thyroid swelling seen on MRI. They saw a dramatic reduction in autoantibodies, the anti-TPO and thyroglobulin antibodies. So I mean, it's there if you look for it. But I mean, we're trained to, here's your synthroid dose typically.
Yeah.
What's your TSH? Here's some synthroid, and we'll just try to titrate to that and maybe to clinical symptoms. But yeah, I mean, it's kind of interesting how much nutrition plays a role there. But it's not the only thing. Obviously, as much as people kind of associate me with a particular dietary pattern, I'm very holistic about exercise and sleep and circadian biology, sunlight and stress mitigation and all that stuff. Do you, I know we have protocols within Revero that are nutrition based. But in your care plan, are you addressing some of these other issues as well? I mean, do we get into some of these other lifestyle related things?
Yes. Yes, we are. Yeah. So now also we have a protocol for like sleep, which is a new thing in Rivero. But even before that, like whenever we meet with the patient, we talk like diet plays a huge role in improving health, but also like you said, exercise. Because the patient I had who's was pre-diabetic and she's not diabetic anymore, she can run now, and
Wow.
she's like, I feel like me being active helped as much as the diet did. Like it's not just the diet, exercise and sleeping. Like the patient with the long COVID, we focus on sleeping. Like you have to get the hours of sleep, and that can make a huge difference in tolerating exercise. And also the circadian rhythm, getting outside in the sun, out in nature, walking. Like I have a patient now that is dealing with anxiety and depression for a long time, like 25 plus years, have tried so many medications, and he's very very good compliant with the diet. And now we are focusing on other things, like besides the diet, like going outside, being in the sun, not avoiding the sun, uh, walking. You don't have to go to the gym. You can just be out walking, whatever you can tolerate. But the lifestyle changes with the diet, like, is a whole like holistic approach, definitely.
Yeah, yeah, absolutely. I mean, I think it is kind of like a whole holistic lifestyle, overhaul for many of these patients, and I think that's what it certainly takes. Do you, as far as your own personal lifestyle, because I mean, obviously, you said you went from vegetarian for many years, and then obviously changed to more of an animal-based low carb type of diet. What other things did you use for your own purposes to get healthier?
Yeah, so I started doing like the red light therapy, because in New Jersey we have sun, but not as much as
Mhm.
we would like to. So I use the red light therapy whenever I can get the sun outside. Always go outside for a walk. I didn't used to do that. I used to sit, chart for hours on end, you like 10 plus hours, and then get up and it's nighttime. Now I have to go to bed. But now I don't do that anymore. I have to go for the walk, and every couple hours I get up and walk outside, not the gym so much. Some weightlifting, going to bed after, the sun is down. I try to not have lights in my house, go to bed, not look at the screen. And this has helped a lot, especially like I said, the mental health plays a big role. And I saw a huge difference when I started just walking outside. It doesn't take much. Just going for a walk outside, I would come back to the computer and feel like, okay, now I can do so much more.
Yeah, you reminded me. You said spending hours and hours at the end of the day doing charts. I mean that is I remember that was one of the worst part of all of medicine is having to sit there. You work hard all day long, and then you got to spend 2 or 3 hours doing paperwork afterwards, which is just it's frustrating to say the least. Do you find that so how do you have like a 1 day a week where you do Revero? How do you fit that into your schedule, or is it sporadic based on when the patients are available?
I work 3 days a week, and all the other days, like 4 days, I'm available for Revero. I have the hours there. I just try to avoid the time when I pick my kids and drop them off to school,
Yeah.
which is 1 hour in the morning and in the afternoon. But no, basically 4 days a week, I'm available morning and afternoon.
Got it. Okay, so it's a little more, and that's one of the things that I think a lot of our clinicians at Revero like the flexibility, and it's just a nicer way to practice, and it's not the because I remember, like I said, when I would go to the orthopedic clinic, it was overwhelming. I mean, it was like all day long. You got 40, 45, 50 patients on your schedule. You got the ER calling you. You've got to call insurance companies. I would have the mid levels of the PAs and NPs would come in and ask me about their patients, and and then you have patients in the hospital you got to see, and calls about that. So it's just it's a lot to deal with, and it's hard to. It really is hard to give your best care when you're just that overwhelmed, because it's like you only got like 3 minutes to make decisions sometimes, and
Yes,
sometimes it's not
yes.
enough. So
Yeah, I love
you got to like the pace has got to be nicer because you get to know the patients a little better. You kind of you can see, like I said, and a lot of healthcare has now gotten to where it's because there's so much throughput, and maybe you get another doctor looking after you for a little while, and you lose some of that relationship, I think, with that. Where do you have any thoughts of licensing in other states? Is that a thought for you as potential?
yes.
That would get you more patients, I think. Yeah.
That's my plan. Yeah, to get licensed in more states.
Yeah. Yeah. I know we have a number of folks that have multiple state licenses that allows them to do that. And like I said, we'll see. Like I said, we're about to go through this funding round, hopefully, so that we can, raise capital so that we can continue to expand what we're doing. And, it's happy patients, happy providers. I think we get good results with that. Anything else you want to share before we wrap up, Danielle? This has been very fun to chat with you.
I mean, it is a lifetime, like life changing experience. Like what I experience and what I see with the patients is really, this is how healthcare should be. Like you said, happy place for the patient and the practitioner, because you're getting results, you're doing what you like. And like when I see the people come off medications to improve their health, I don't feel tired that I charted or worked for them. I don't know. You just don't feel tired when you do something you love.
Yeah, fair enough. That's a great way to look at that for sure. Anyway, Danielle, well, thank you for sharing us this interview, and thank you for working with us with Revero, and obviously helping lots and lots of patients, and hopefully many, many more to come. So have a wonderful day over there in New Jersey. I guess it's just at lunchtime there, so maybe get a nice lunch, and I'm sure we'll talk again soon. Okay, bye-bye now.
Yes. Thank you so much for your time.